Hey everyone, this lesson is on vitamin C deficiency. So in this lesson we're going to talk about the signs and symptoms of vitamin C deficiency. We're also going to talk about the condition known as scurvy. We're also going to talk about why we get those particular signs and symptoms, and we're going to talk about what we can do to diagnose it and what we can do to treat it. So vitamin C deficiency is caused by a reduced dietary intake, particularly of citrus fruits and other fruits and vegetables. If you haven't watched my other lesson on vitamin C absorption and metabolism, please check out that lesson for more details. So if we do have a reduced dietary intake for whatever reason, we can have issues with collagen synthesis, catecholamine synthesis, and carnitine biosynthesis. So vitamin C plays a critical role in collagen synthesis, catecholamine synthesis, and carnitine biosynthesis, along with synthesizing nitric oxide and prostaglandin metabolism as well. So there are many functions with which vitamin C is critically important, and a lot of the symptoms have to do with issues in each of these downstream pathways. So we're going to talk about how and why these symptoms occur. But first, vitamin C deficiency, what is it? What do we actually call it? We actually call a condition of vitamin C deficiency as scurvy. So why do we get it? Who gets vitamin C deficiency? Well, vitamin C deficiency or scurvy is considered a historical condition, but it can still happen in today's society. It generally occurs in severely malnourished individuals. As we talked about before, it's due to a reduced dietary intake, particularly of citrus fruits and other vegetables. So patients or people who get vitamin C deficiency or get scurvy include institutionalized patients, chronic alcohol abusers, and individuals with a chronic illness. These three sets of patients are the big category of patients that are at risk for scurvy or at risk for vitamin C deficiency. And vitamin C deficiency symptoms can begin within 3 months of decreased vitamin C intake. So in one of these individuals that we talked about before, if there's been about 3 months or more of reduced or absent dietary intake of vitamin C, we can start to see symptoms even within 3 months. And symptoms usually occur when vitamin C levels go below a certain level, and that's levels about less than 0.2 milligrams per deciliter or less than 11 micromoles per liter. So what are the signs and symptoms of scurvy or vitamin C deficiency? I've broken them down into specific categories. The first one is dental. So these include gingivitis, bleeding gums, receding gums, and dental caries. So these people are at risk. So you can see in this image here, receding gums, you can see that there's likely more issues with dental caries as well, so more cavities. And this is again because of that requirement of vitamin C for collagen synthesis. A lot of this, the dentin in teeth and other structures are synthesized and made with collagen. So if we don't have proper collagen production, we're going to have issues with these structures. Another category of symptoms and signs include hematological and connective tissue issues. These include ecchymosis, so bruising, petechiae, and hemolytic anemia. So all of these can be caused by issues in other pathways as well. Another category of signs and symptoms include integumentary and rheumatological issues. This includes impaired wound healing. This makes sense. We need collagen for wound healing. Scars are made of collagen. We also get follicular hyperkeratosis. We also get what we call coiled hair. So the quality of hair is just not the same as it used to be. Perifollicular hemorrhages also occur. So you may see a picture or see a patient with their skin, and all surrounding their follicles of hair, we see these little dots of hemorrhage. We can also see joint pain. Again, joints and the articular surfaces all require good collagen and good collagen health and maintenance. We can also see a sort of Sjogren's syndrome as well. Systemic issues of scurvy include psychiatric issues like depression. We can also have fatigue, weakness, anorexia, neuropathy. We can also have hypotension. Again, vitamin C is required for synthesizing catecholamines like norepinephrine, and norepinephrine acts as a vasoconstrictor, so that helps us with maintaining our blood pressure. So we're going to get hypotension. We're also going to see dyspnea as well, and if scurvy and vitamin C deficiency last and is prolonged, it can actually lead to sudden death as well. So very serious condition that cannot be missed, that should be picked up, because the treatment is very simple, and we'll talk about that in the next slide. So now that we know the signs and symptoms of vitamin C deficiency and scurvy, how to make the diagnosis? The diagnosis is via checking a plasma and leukocyte vitamin C level measurement. So generally speaking, leukocyte vitamin C levels are the better measurement. So check leukocyte vitamin C levels. So you're generally going to see with vitamin C deficiency or scurvy, low plasma and leukocyte vitamin C levels. That makes sense. And so that can help you with the diagnosis. You're also going to see a lot of these other signs and symptoms we talked about earlier. So once we make the diagnosis, how do we treat it? Treatment is simple. Again, it just requires vitamin C supplementation. So we just have to replenish the patient's vitamin C. And we generally break this down depending on if the patient's a child or an adult. In children, we use 100 milligrams of vitamin C 3 times a day for 1 week, and then we go to 100 milligrams once a day for several weeks until symptoms and other issues have resolved. And in adults, we use 300 to 1,000 milligrams of vitamin C daily for 1 month. And resolution of symptoms can be quite quick. So some of the constitutional symptoms can actually resolve within 24 hours. And besides simply supplementing with vitamin C, there are dietary options to get vitamin C from food sources. These again include fruits, so citrus fruits, tomatoes, strawberries, some of the things we've talked about before, and also a number of vegetables as well: potatoes, Brussels sprouts, broccoli, cauliflower, cabbage, spinach, those types of vegetables. So quick recap of the lesson. So we get vitamin C from our diet. It's an essential vitamin that's found in a variety of fruits and vegetables. If we don't get enough vitamin C, we get a deficiency leading to the condition known as scurvy. And scurvy has a wide variety of signs and symptoms, including dental issues like receding gums and dental caries. We also can see issues with hematological conditions. We can see issues with integumentary and rheumatological systems, and we can have systemic issues like depression, fatigue, weakness, and others as well. And once we see those signs and symptoms, we can confirm the diagnosis through checking a leukocyte vitamin C level, which is going to be low, and we're going to treat the condition with vitamin C supplementation. And remember, it's different with children and adults. Generally, symptoms like the constitutional symptoms will generally resolve within 24 hours, and some of the other symptoms like bleeding gums may last for a few weeks. And instead of just taking a pill for the vitamin C, you can get vitamin C from your diet as well. Again, some of those fruits like citrus fruits, tomatoes, strawberries, and a variety of vegetables as well. So if you haven't already, please check out my lesson on vitamin C absorption and metabolism. And if you haven't already, please consider liking, subscribing, and clicking the notification bell to help support the channel. And thank you so much for watching, and I hope to see you next time.